Becky Oster-Blanton from Active Health Physical Therapy, here with Taylor. We want to do a little demonstration of good body mechanics and bad body mechanics. We get tons of people that come in and have lower back pain, neck pain, shoulder pain, and a lot of them work in paper mills or in body shops or in, we're here on Warren Avenue. There's a lot of jobs where people have to do a lot of lifting, Riverside, the industrial park, and we have all kinds of complaints of mostly lower back pain, but aches and pains other places too. And when we ask a lot of people, how did you hurt yourself? I want to say 8 times out of 10, it's from lifting something. So the original injury doesn't necessarily come from lifting. It comes from poor posture, poor body mechanics, trauma over a long period of time. You might have heard the term micro-trauma. So you do something 10,000 times, and on the 10,001st, it finally hits you and you have pain. But what I want to do is just show you proper lifting and improper lifting so that you have something to compare it to. So maybe you can save yourself that 10,001st injury. So you can see we're out here with these kegs. There's no beer in these kegs. I know she's not quite 21. They're empty kegs that we use for strength training out here with our strongman guys. They're strongman competitors, but we're going to use them to demonstrate because they're perfect. So the first thing I'm going to have Taylor do is show you improper body mechanics. She's going to pick up the keg. You can see she's going to keep her legs pretty straight. She's going to keep the keg back up a little bit. She's keeping the keg kind of far. You can see her back is totally rounded, right? And she's going to lift that up, and you're going to see as she lifts it up, go ahead, it's coming primarily from her lower back. And a ton of people lift like that. And I don't want to call it an excuse, but the reason I get is, well, my knees hurt, so I lift with my back. And while that does make some sense to me, if your knees are hurting, come into physical therapy, we can fix your knees and your back, but that's a whole nother video. So the way you should pick this up is you should approach the item, get as close to it as possible, get your feet about shoulder width apart, bend your knees to get as close and as low as you can. You can see that her knees are bent, her feet are flat, her back is now straight, and the force is going down, as is her back. So as she loads her spine, she's loading it on top of itself. She's not loading it out here, she's loading it here. So your spine is up and down, so you want to load it as up and down as possible. When she lifts up the keg, she holds it close. So you can see now all the force is going the same direction as her spinal column. And same thing when you put something down. I see a lot of people pick stuff up really well, and then when they go to put it down, they bend over and they keep their knees straight again. So when she goes to put this down, you want to make sure that you bend your knees and put it down the same way you're supposed to pick it up. That way you keep the amount of strain through your lower back, your mid back, and your hips to a minimum. If you are having lower back pain or knee pain or hip pain, especially when you lift, or even if you're feeling a little stiff, come in and see us. In a couple of visits, we can show you some stretches and improve your body mechanics and possibly your core strength, and make sure that you don't have that 10,001st trauma that makes things go pop, and then you're laying on the couch for 4 days dying in pain. So give us a call, 207-878-5002 or www.physicaltherapymaine. Have a great day. Take care.